Hello, I'm Dr. Nicky Keay. I'm a medical doctor and the author of Hormones, Health and Human Potential. I want to talk a little bit about HRT, hormone replacement therapy. This consists of some form of estrogen, typically estradiol, most active form of estrogen, alongside a form of progesterone. Who might consider taking this? This is typically women who have low levels of these hormones, so women who are experiencing perimenopause and menopause. A few years ago, or several years ago now, there was a study that was reported on by media outlets claiming that there was a big increase in breast cancer as a result of taking HRT. Since those initial headlines, this has now actually been refuted, and whilst there is a very small increase in the risk of breast cancer relative to women who are overweight, not taking exercise, smoking and drinking alcohol, actually this is quite a small risk and equivalent to taking the combined oral contraceptive pill. We also know that there's a decrease in the risk of breast cancer if you are taking 2.5 hours of exercise or more per week. And previously, I have spoken how important it is for women as we go through perimenopause and approach menopause. It's very important that we review and reevaluate our lifestyle choices, particularly in terms of exercise and nutrition. So, if you are in perimenopause, menopause, and you've made changes or reviewed your lifestyle, and you are now considering other options, what about HRT? Well, the first thing to say is that it's entirely an individual's choice whether she wishes to try HRT or not. And the indication why you might choose to try HRT is for symptoms, for quality of life. In other words, if you are experiencing debilitating symptoms in terms of hot flushes, mood changes, and these sorts of things. And that is the main indication for taking HRT. Recently, it's also been acknowledged that this could be a very good treatment, a primary treatment for poor bone health and prevention of osteoporosis. As an additional benefit, we also know that HRT is helpful in the prevention of heart disease, although HRT should not be taken solely for this reason. So if you have decided you want to try HRT, what are the options for you? Well, the best form of HRT, as recommended by the British Menopause Society, comprises of the estrogen component, which is taken through the skin transdermally. This could be either in the form of a patch or gel. My personal preference is gel, which comes in little individual sachets if you choose, because it is easier. Well, first of all, it's convenient if you're traveling to take this, but also it's very easy to titrate the dose for the individual, because HRT, it is very much a case of personalizing the dose to counterbalance symptoms that you might be experiencing. So that's the estrogen component. What about progesterone? Again, there are many choices, but the one which I personally favor, of course it's your choice, is what's called micronized progesterone, which is molecularly identical, body identical to that which you produce yourself in your body. And you can take this either every evening or in blocks. Typically, you might do that taking the progesterone in blocks if you're still having some sort of menstrual cycle. So those are the options, but a few little extra comments for you. Please bear in mind, HRT is not the elixir of youth. You're not taking it because you want to be 21 again. I'm afraid that that's not going to happen, but it certainly can improve your quality of life. And the fundamental principles of prescribing any medication hold. In other words, you start with the lowest possible dose and potentially you slightly increase titrate upwards according to the symptoms and the response. This does mean you will need a degree of patience and perseverance, and the effects, you won't fully feel the effects at least for 3 months. So it just take a little bit of adjustment and patience, as I describe, but it is possible to find what is best for you. All women will need to take both components of the HRT unless you've had a hysterectomy, in which case the progesterone component isn't absolutely necessary. The other bit of good news for us women is that with a recent change in the law, it is now possible to have a prepaid prescription for all types of HRT products. And these products are available, licensed regulated forms, on the NHS. So I hope that helps in a little bit of background explanation about HRT.